viewers, welcome to this COVID-19 update for today, September 9, 2020. We are here with the Honorable Minister of Health, Dr. Frank Anthony. Good afternoon, Dr. Anthony.
Good afternoon to you.
Could you please give us the latest update on the COVID-19 in Guyana?
Well, right now we have about 1,703 cases of COVID-19 as a total number. And of those, we have maybe 300 and something cases that are active. And they're distributed across the various regions of Guyana. The most active area would have been in Region 4, where we have a number of cases on the East Bank, Georgetown, and the East Coast. And the second active area has been in Region 9, and we also have another hotspot, so to speak, in Region 1. We have teams in these various areas that are working very steadfastly to manage the cases in these areas. But nevertheless, while we do the clinical type of work, it is always important that the public also participate in helping us to prevent the spread of this disease. So as of today, I think we are able to see these cases and manage them well. And we have been working with our lab to ensure that we get a faster turnaround of the laboratory results. You would have known that last week we were talking about a backlog of cases that in some cases at one point in time we had as much as 1,900 samples as a backlog. And then we were able to reduce that to about 1,000. Well, I'm happy to report today that we actually have cleared that backlog, and therefore, as samples come in, we have the capabilities of processing the samples. If we get a lot more samples, then we might have a little bit of a backlog. But as of now, we have literally cleared a lot of the samples that we've had. And we were able to do so because we had sent 500 samples initially to CARFA. Of those 500 that we sent, we got back close to 450-something samples. So there are just a few remaining from that first batch. And Monday, we sent 138 more samples to CARFA. And maybe in another day or two, we will be seeing the results of those as well. So that's one of the ways that we have been able to reduce the backlog by outsourcing the processing of these samples. And CARFA has been very good to us in helping us to reduce that backlog. We have since looked at some other options, and we have explored an option if we get back a lot of samples that we are unable to process here in Guyana, that we would be able to send some of those to the United States for processing. And there are two centers that we have been talking with in the United States, one that is based out of Houston and the second one in New York. So again, if we have lots of samples coming in and we start seeing an accumulation of samples, then we would be able to use these two centers in the US to process some of our backlog. In addition to that, we have been exploring with the government of Brazil, and in particular the state of Roraima, to be able to send our samples from Region 9 across to Brazil for them to process them for us. We'll be having a meeting with the Brazilian authorities on Friday, and hopefully after that meeting we'll be able to finalize all the arrangements. So Region 9 samples can go across to the border to Brazil, to the labs that they have in the state of Roraima, and we'll be able to process it. So I think as these challenges come up and these obstacles are thrown at us, we are trying to figure out ways and means of how to resolve these problems. And I must say that a lot of people are concerned, and a lot of people have come forward and offer us different solutions, put us in contact with various organizations, and these have been very helpful to help us to reduce this backlog. So I want to assure the public that our processing time for these samples would be drastically reduced as of now because we have cleared a lot of the backlog.
Okay, what's the current processing time?
Well, now, as soon as we get the samples, we're able to take them into the lab. So I guess, as of now, within a 24 to 48 hours period, we should get back the results. But again, that is contingent because remember we have a certain capacity. We can't exceed more than 300 currently at the national lab. So we have that limitation per day. And so if we go beyond that, if we receive more samples than that, then we'll have a little backlog accumulating. And I think what is important for people to understand, when we first started doing PCR in Guyana, and as of early March when this was started, to sometime in, let's say, 2nd of August when we took government, the average per day, if we take the entire period and look at how much samples were done, the average per day would have been about 31 tests per day. When we came into office, and within this short period of time, we have been averaging close to 150 or more per day. So you can see there's a big difference in the amount of tests that was done for that period versus what we are doing now. And even with us taking it up to that level, it is still not enough. And we want to do more, and we want to be able to give some of the outlying regions their own ability to test. And that is why we are exploring other options to make sure that we can do more tests in those regions and get it with a fast turnaround time.
Okay, can you outline some of the testing sites, the authorized testing sites? I know there's public and private.
So publicly, the public site, the public sector, we can, any one of our health facility can technically be a site where we collect samples. What that really is that we'll have a test kit, and if there's a patient there, the doctor there would be able to retrieve a sample from the back of your throat, right? And then they put it in a container, and then they send that down to the lab. So almost any one of the health facility would be able to do that. We have put test kits or make test kits available to all the regional hospitals, all the district hospitals, and so that anybody going to these facilities, if they have the signs and symptoms of COVID, the doctor there can take off a sample. So right across this country, our regional hospitals and our district hospitals are able to offer this test, so to speak. Then, in addition to that, in Region 4, we have identified 2 areas, one site at Paradise on the East Coast and another one at Herstelling and at the Georgetown Hospital. So in addition to these other places that I've just spoken about, in Region 4 specifically, we have these 3 areas where we can see more people and be able to do more sample collection. Once that sample is collected, it is then taken into the lab. It is then registered and so forth, and then they go through the process of processing that sample. And there are different stages in how they process the sample, and then we get a final result. So that's what has been happening so far.
Okay, thank you, Minister. Before you wrap up, any final comments you'd like to make pertaining to testing and the backlog clearing?
Well, we continue to work very hard to make sure that we can have a faster turnaround time. And as I said, we are exploring various options to be able to do more testing. So apart from the PCR testing, that's the gold standard, which we're using right now, we are also exploring what we call a point of care test. So when you come to the site, that you can get a test there, and within 15 to 45 minutes, you can get back a result. So you don't even have to wait a 24 or 48 hours. Right now, we are exploring the possibility of acquiring a few of those machines and the consumables to go with it. That test can be a little bit expensive and so forth, but we have been talking to a number of companies to try to get that type of testing here. They are fairly sensitive. They are not as accurate as the PCR, but they are very accurate. And if we get those machines and when we use them, if we have any inconclusive result, we will then be able to revert back to the PCR. But it's an option because if somebody comes to one of our clinical sites and we have those machines, within 45 minutes we'll be able to give them a diagnosis. Okay. So that really is going to change how we respond and the kind of care that we are able to offer. Those machines, because they do not require a laboratory setting, as we need now for the PCR, those machines, we can deploy them, say, to Region 9 or Region 1, or Region 8 or Region 7, so that, the challenges with those regions, they don't have the kind of robust laboratory structures. And therefore, if we can have these machines that can work in, these adverse conditions and give you fast results, then I think that's the kinds of solutions that we want out there. So we have been pursuing this. It's a challenge because as fast as these machines are made in the US and other places, those countries take them for use in their health system. But nevertheless, we've been working with some global partners to see whether or not we can secure them. But that's something that we have our eyes on, and hopefully we'll be able to get a few of those machines to Guyana.
This has been your COVID-19 update for today, Wednesday, September 9, 2020. Today the topic was testing, and we spoke with the Honorable Minister of Health, Dr. Frank Anthony.